name is Dr. Tracy Karras, and welcome to the SOH, otherwise known as the state of healthcare. The state of healthcare in the United States, let's be honest, is actually one of illness. We spend far more money than any other nation to receive less care and less quality of care. Walter Cronkite calls it neither healthy, caring, or a system. As a healthcare professional who's had 20 plus years in this system, my focus is on prevention and education and trying to get patients back to actually enjoying happy and functional lives. So it's frustrating to me when I have to watch my patients and my friends and my family fight against a system just to get what little care they do, and oftentimes get a medication thrown at them instead of actually looking for what the problem is, or trying to find a healthier alternative that's not going to damage them in the long term. That's why we're here, so I invite you to join me on this journey. We're going to be starting to raise awareness. Awareness is the first step in any good 12-step program, right, to making change. We have a broken system where only a few people profit, and I'm not picking on all of those hard healthcare workers in the trenches, because those are the people unfortunately getting burnt out and leaving the system, so we need to figure out what's going on. So in this podcast, we're going to be interviewing some healthcare professionals, people in the industry, people surrounding the industry, and try to figure out what's going on here. What's broken for them, what would make their lives easier, and how we're going to do this. So welcome to the SOH, and let's figure out what's going on.
Perfect. Hi, this is Tracy Karras. Welcome back to our second episode of the SOH, or State of Healthcare. And today we are here with Lianne, and she is a physical therapist, which is obviously a near and dear to my heart profession. But I'm going to actually ask her to introduce herself and kind of talk about her background, and then we're going to play and debate things in the world of physical therapy. So I'm just going to kind of let you take it from there to tell me how long you've been in the field, like what kind of background, where are you at now?
Yeah, absolutely. I'm Lianne Rogers. I have been practicing as a physical therapist, I think almost 15 years now. I started out doing a lot of outpatient clinical work, orthopedic, sports injuries, and then I went in, I also did on the side like SNF, skilled nursing facilities, and then I went in and did some school work, so working with kids in the school system, and then just kind of realized that wasn't my passion and got out of that and went back into kind of orthopedics and then started my own practice. So currently I'm the owner of Balance by Lee Physical Therapy. We are a mobile physical therapy practice. Even though we're in the home, we are still considered an outpatient practice, so we're not your traditional home health where the patient has to be homebound to be seen. We're a hybrid practice, meaning we see both cash patients and Medicare patients, and primarily we focus on the 65 and older population.
So what sort of motivated you to start your own thing?
Yeah. So a lot of it was, one, I had two younger kids, and so working in outpatient clinics, hours are, you're kind of there till 7 at night, late hours or early mornings. And then the second part of it was just seeing the quality of care in the setting, especially primarily with older adults. If they were dealing with balance issues or just any kind of exercise in general, they kind of need a little more hand-holding to make sure they're doing the exercises right. And a lot of times you don't get that. You can't do that in an outpatient setting when you have multiple patients that you're seeing at once. And so it was kind of just doing some research and realizing that this type of model exists, and that you can go into the home and treat them and, see them one-on-one and give them better care, or at least more attention, I should say, than what they would receive if they went to a traditional outpatient clinic.
Okay. Now break it down for people who don't understand, because I know what it's like to be in an outpatient clinic where I've got like a schedule of 20, for an 8-hour day. But like, what is your average? Like, was that always your outpatient experience, or break down for me, kind of, for people who wouldn't understand. Like, what do you mean by 3 patients in it?
Yeah, so most clinics I think now they're probably better, but there's still some clinics out there. I worked in a clinic very early on where we were scheduling patients every 15 minutes. So, you'd have patients, 4 people in there in an hour, and everyone's program is different. So some people may be there at least for an hour. Some people were there for a little bit longer. So you had a lot of overlap with patients. And it made it for just a really chaotic sometimes and really busy day. If you had someone who came in and they were flared up, or something got hurt them from the last visit, or something from the last time you saw them, and you needed to spend more time and attention with them, it was a lot harder when you had 3 to 4 other people in the clinic who you were responsible for, and you're trying to make sure what they're doing is right and they're going to be safe. So when you're in that type of setting, it's hard when you have someone who is older trying to make sure they're doing exercises right. And a lot of clinics have, we call them therapy aides, therapy techs that help. But at the end of the day, that's your patient and you're still responsible for them. And so if they were to get hurt, even though the tech was there, it's my responsibility. Yeah. And I think, like I said, most clinics are probably better about that these days, especially when they try to schedule Medicare patients. But it's still a challenge. You've got to learn time management as a new grad. You've got to learn, how much to do with a patient and when to move on. And I think a lot of that isn't taught in school. That's something you have to just pick up on the job. And you either sink or you swim.
Well, and, because in my first job out of school, we had to see 25 patients a day in the 8 hours. And so we had 1 to 2 patients every 15 minutes. If you had an eval, you had 30 minutes, quote unquote, but really you didn't. You were kind of in and out. So when you have, now with your own business though, you actually get that whole hour one-on-one with a patient, right?
Yeah, so I'm driving to their home and seeing them in their home, and it's an hour, or if it needs to be a little bit longer, that's, fine too. But yeah, I'm there and I don't have the distractions of, oh, this patient has this question, or, this patient needed help here, or they're done waiting for their exercise, just waiting for me.
Right.
I don't have to multitask and, try to think in my head, okay, what does this one person over there need to do next? And say goodbye to this person, but greet the next person that's coming in. I can have my entire attention focused on that patient in front of me.
Well, and I think now, even though a lot of what I've seen now is patients there's like a mix. It's now a half hour per patient. So you get a half hour, but the patient's still there an hour. So there's like that half hour of overlap where the therapist has to hand the people off to the techs. And the good and the bad, right? If you've got an amazing tech, it's great. But then there's just something, as terrible as it's going to sound, that I feel like is better of having the one-on-one of the therapist for that period of time, So.
Yeah, and I think there is a certain patient that will do fine in the clinic in that kind of setting, will, be okay. Probably a lot of your younger clientele will be fine, but when you have someone 65, 70 who isn't very mobile, who maybe is a fall risk, who, has a hard time remembering their exercises, and you may tell them and show them, how to do it, but after 5 reps, they're doing it wrong. And, you kind of have to be there next to their side to help them. And you can't just say, okay, I explained it to you once. They're going to figure it out for the next 3 sets and walk away and come back and think that they did it right. So yeah, and then you just don't have the time to assess, maybe they did a set, but it really hurt them. And you walked away because you had to go help someone else, but they thought like, well, it's supposed to hurt, so I'm going to keep going and doing this. And in reality, you probably should have stopped and not done all of the repetitions I told you to do. But because I'm not there, they just keep doing it. Right. And so they may get hurt. So yeah, but like I said, so that setting may fit for some people. I just think your typical older adult probably doesn't fit in that category unless they're, this really high functioning senior athlete, really active, great, and knows their body. But your general 70, 80-year-old patient won't. And unfortunately, with the baby boomers and that population exploding, you don't go into a clinic and say you're not going to have at least 5 patients on your schedule that are going to be 65 and older. So, the new grad walking into a sports clinic or your regular traditional orthopedic clinic is probably seeing 50% or higher of Medicare patients.
Is that what motivated you to primarily focus on that population for your business? Or I guess why did you structure it that way?
Yeah, that was the main reason. It was just seeing that, they're going to get better. If someone is deconditioned or coming off surgery, they'll get better, but they won't, I don't think they can get as well as they could if they, you weren't giving them the attention that they needed.
And then it sounds like a little bit of work-life balance, right? So I get it, because for me, outpatient, the bane of that was notes, like documenting, plus handling the 20 patients, plus feeling like I was actually doing any quality of care. And then I'd be like, it's 7:00, but I still have like 10 charts to do, or I have to write a progress note, or I have to do this. And so I feel like, is that a little bit what you've found now having your own business, that you actually get to like schedule it and have that balance again? Or how does that work for you?
Yeah, absolutely. The time back and the freedom and the flexibility back. I, at the most on my busiest day is 5 people.
Oh, nice. Okay.
And so to do 5 notes compared to, 16 to 20 notes is, a huge change. And it's just having that freedom and that flexibility to spend with the patient, or if they're really hurting that day, okay, we're only going to do less, we're going to do what's appropriate for them. And not having the pressure of productivity from a clinic, on what you have to do and what you have to bill and how many you have to see and this and that.
Right. And that's kind of nice, because I feel like then you actually get to feel like you're making a difference, if that makes sense. Because I feel like you can, again, you said you can do that in an outpatient clinic where there's going to be a percentage of people that you take them off the street and they exercise and they're going to feel better. But whether or not, like, whatever, it's just that percentage. But then you also have that where you're torn, where you're like, this person could be doing so much better if I could actually spend the time and do the things that I need to do. But the hard part is from an insurance perspective, or from that end of the world, you have to have so many of these patients scheduled out, but you don't actually make money. So then it puts that productivity burden on the therapist, and then the quality of care then goes down. Well, absolutely. And I guess then my question for you is, what are your 3 biggest challenges that you face now, or maybe the 3 biggest challenges you felt like you were facing from a healthcare perspective?
I feel pretty blessed with my practice right now, that on a daily basis, I don't think I run into a ton of challenges. As before in a clinic, there were, so many challenges, right? Dealing with other people, patients and your coworkers. It's, if I show up and they're pretty much ready and eager to work, and they're motivated to see me, I don't have, my cancel rate is pretty low, just because I'm coming to them. They're not driving. I can't say that I have consistently these challenges every day in work. It's been nice to kind of get, I don't know, when I think of outpatient clinic, I think of it just being very busy. And it's a busy and it's a fast-paced environment. And if you can't keep up with it, then it's hard.
Well, I guess then as an outpatient therapist, because again, that's the hard part, right? Because the whole, we're talking about the state of healthcare, right? And trying to, and it feels like for yourself, like you've actually carved out a niche that is making a difference, not only for you as a therapist, so you avoid burnout, right? So you don't drop out of the profession, and you actually get to make a difference in the quality of lives of people. So I feel like it's actually kind of maybe one of those happy ending stories, but then there's all these therapists in these basically in this, arena or this setting. So I guess as a therapist in that setting, what was your biggest challenges when you had to do outpatient?
Yeah, I mean, definitely just the time spent with them was a challenge, feeling like I was giving equal time and attention to everyone that I was seeing that day. And that didn't always happen. There was times where I barely saw that patient and they were with the tech most of the time. And that's a daily challenge in those clinics, in that clinic, is your time management. And then I think just, you'll have to figure out and see which patients need you less and need you more. And, but then that changes too. The patient you think that doesn't need you very much comes in and it's like, has all these problems. And you're like, oh, that just messed up my whole, how I wanted my schedule and the flow. And yeah. And, or, you're trying to put in a patient to get seen and you think you can just slide them in with another patient that's easy and both of them come in, completely irritated and flared up for whatever reason. And it's, you're trying to put out fires when you didn't think you had to. But, I think as you get more experience and seasoned as a therapist, you figure it out and you kind of are able to manage that. But it's stressful when you have to do that time in, day in and day out and multiple times a day.
Well, and I feel like therapists are usually pretty good about us being able to let's do this instead, right? I mean, that's constantly our job, right? Even with your ones that you're seeing in the home, it's constantly JK, I had a plan and now you fell off a ladder. But so I feel like we have that, but it also makes me sad because I think sometimes patients don't realize all of the pressures that we're actually under when they come in an outpatient setting. You come in and you think, I'm just here to see my therapist. And then you're like, but why are they only here for 5 minutes with me? And they have no idea that you're looking at this giant schedule. And then you've also got to do all these notes. Or if you don't, you're at home doing all these notes, right? There goes your time with your family and your basically your balance of life. And then, therapists also have to make time to call doctors and they have to do things like that. And I think for me, I probably told you the story. When I was in PT school, I was interviewing and the therapist that interviewed me, he goes, I just want to let you know that we screwed you over. He goes, I could bill for a Band-Aid and it got covered. And he's just like, so I'm going to let you know that for the rest of your life, you're going to spend it justifying to insurance companies why you're doing what you're doing because they figured it out and they cracked down. So it makes me sad that as much as I want to complain about insurance companies, I also have to look at the therapists and the medical people that abuse the system. And now the pendulum's so far the other way.
Right.
That, these other therapists now. And the problem is the people that suffer are the patients. And that's what makes me sad.
And they don't understand it or realize it.
Yeah, that this is what happened in this system. So tell me about, sorry, go ahead.
No. I was just going to say they kind of expect more attention, I think, when they go to therapy versus when you go to a primary care doctor or a doctor in general. You already know in your head, well, they're only going to see me for 5 minutes and then that's it.
Right.
But I feel like there's an expectation when they walk into a clinic that they're going to see you more. And if they don't, then, that they get upset by it or they are angry by it. But it's our schedules are just as busy sometimes as physicians are.
Right. I remember seeing my primary care and he has a sign up that basically says you can only have 3 problems you come in with or whatever. You may have more stuff, but he's limit it to 3 complaints. And I went in there and he's like, well, I'm double booked all day. I'm like, me too. But I actually spend time chatting. I spend a good 15 minutes with my people, not just 5. So, but I know. It's also, sorry, go ahead.
No. I was just going to say, I tell my patients to write down their questions, have a list, have a sheet of paper. And, because your time is limited when you go into the doctor.
And it's sad because, again, especially when someone's older, as terrible as it's going to sound, there's confusion sometimes. Again, any person going into the doctor, there's medical terms being explained that they may not understand. Then they're probably going to forget their questions if they don't write them down. And then also, I feel like sometimes people get nervous or they just get stressed out in the doctor situation. and then you don't get your needs met, and the doctor's like, oh, they said they were fine, and then they move on. Oh.
Yeah.
But
Yeah.
From a therapist's point of view, and it's so hard, and it also makes me sad that that is what they have to expect when they go to the doctor, because they're under the same constraints that they have to see 60 people in a day to do this, you know, to actually, because it makes me sad when I get patients and they're like, the doctor actually spent an hour with me, and I'm like, you never hear of that.
No. Yeah, that is very rare. Yeah, and if you get a doctor like that, then I would say, you know, keep them as long as you can.
Right.
Yeah.
I'm glad that you actually prepare your patients for that. I think that's a big step. It's like, sometimes with my older patients, a lot of my time, not a lot of times, but part of my therapy session is actually interpreting medical stuff for them, or help advising things like, here's what you need to do with your visit, or let's write your questions down, or you need to tell them about these medications, or you need to tell this doctor that you got these medications added because they're not communicating with each other. So it feels like therapy is a go-between.
It is, yeah. And with older adults too, there's a lot more, and being in the home, there's so much more than just therapy. Like, you know, you're helping them with so much more, and then you see so much, a different side than you would see, I think, in the clinic. They're more vulnerable, willing to share. So like the biggest thing is I see so many just patients who are isolated and depressed, and it's sad, and it's just a lot of times just listening to them talk through that stuff and hear them, because they don't have anyone who will sit there and listen to them. And that's pretty disheartening too.
Right. Is that, because you actually started your business during COVID, right? Like, you started working on that.
It was actually, it was a side business for a couple of years, and then it pretty much, I launched it in 2021. So right after COVID, yeah.
Okay. How did that change your world? Because I don't know, are you running it? I mean, I feel like in general, with the older population, as sad as it's going to sound, a lot of them are isolated anyway. Did you see that amplified with COVID, or like, did you notice changes?
Oh yeah, it definitely isolated them, you know, and then even though things started opening up and returning, they were still very fearful to go out. Especially if patients, and a lot of the patients I see have a lot of comorbidities, so they were very apprehensive to return to an outpatient clinic, even though maybe they had done it before and they didn't have issues with it. They just wanted the therapy in their home. And so I think COVID definitely opened up the mobile practice side of things a lot quicker, I think, than you know, we would have expected. There's mobile primary care doctors, there's a mobile dentist, there's a mobile optometrist. Like, I've met so many different mobile healthcare practitioners since starting my practice, and it's just kind of like, oh, that doesn't surprise me, that when I hear something new, it's like, oh yeah, that makes sense. I think there is even like a mobile dentistry that goes out and you know, will do clean your teeth and stuff. So but yeah, definitely the isolation for sure was huge. And if they lived alone or they didn't have a lot of interaction, just that whole like conversation piece, you know, I felt like, oh, I'm here, you're my one person that I can talk to for today. And so, you know, a lot of it is just chatting. And I have a patient like that who we spend probably half our session just chit-chatting. She tells me how she's doing, what's been going on in her life, what, you know, outing she went on, and then we'll do a little bit of exercise. And but that's kind of also therapy for her. You know, she lives alone. She has a caregiver that comes in twice a week for 4 hours, but otherwise she's pretty much on her own. And she has slowly gotten back going out with friends, and doing dinners and lunches and things like that. But otherwise, if she doesn't do that, you know, we're kind of the consistent piece every week of, okay, Lianne will be here and I can tell her what's going on and chat with her and socialize.
I think actually people don't always realize that component about things is the mental component is almost as important as the physical, or how much of the mental component will affect the physical part of it.
Yep.
I don't know if you noticed with you. Sorry, I keep always
Go ahead.
bouncing in, but yeah, go ahead. I don't know if you noticed it from there.
No, I was just going to say there are some days where we spend more talking than exercising on some patients because it, like you said, it is more just as beneficial, sometimes if not more, just depending on what they're going through.
Do you ever have, so sometimes I have this with mine where like the caregiver, so there's always like in the ones that are in couples, like so where sometimes you're working with one, but then the whoever the caregiving side of it has a lot of questions, because I feel like in a lot of my older couples now I have the one that has a lot of questions, and then they're like not, and I feel like a lot of my stuff is educating that person, like here's how things are changing, this is what you're going to have to do to take care of your husband now. And I don't know if you run into that.
Yeah, for sure. There's a lot of couples and spouses caregiving for their spouse, their partner. And I think our profession in general, there's always education involved. And if you're not educating, then you're doing a disservice. But yeah, there comes with a lot of questions, and that first visit is a lot of just talking to both of them, answering questions, and helping them think through things, because things that they didn't think of or they didn't know to think of, that comes up. And then especially being in the home, you see so much more than you would in a clinic. You can tell them to walk me to your bedroom, let's see what your bathroom looks like, and here's your kitchen. And so whatever specific problem they have, they can be like, oh, let me just show you, instead of trying to describe that. And I guess that's another challenge too in the clinic that you would face, that you're trying to like, okay, let's try to mimic this and set this up to how you would get in and out of your bathroom or where your bed is. And that's a challenge too. Instead of being in the home, it's so nice to just be like, okay, let's just walk to your bedroom and show me.
And then you actually then get to see, because it's there was that show House, and he always said patients lie, and I actually believe that, but I don't think they always lie because they're trying to deceive you. I think that sometimes people want to present themselves in their best light, or they don't remember. And so a lot of times you'll be like, how was your week? And they're like, it's good. And then, they maybe had a fall, or they had this, or there was this that happened.
Yeah.
Whereas if you're there, sometimes it'll jog their memory, and they'll be like, oh yeah, I had this. So that is the good and the bad of the outpatient, right? So
Yep.
I do love outpatient in a fact of like, you get the lazy part where people come to you, but then there's a bunch of them that come to you, right, at the same time. So there is that portion of it. I guess for me, my question is like, if you, and again, I have to give you kudos for kind of designing your own, like seeing like what you did and didn't like, and finding a way to design your own thing that worked for you. So my thing is if for an outpatient clinic or for one of those, if you had to make an ideal, or how would you vision that? Because I feel like you've already sort of found kind of your magic bullet for yourself.
Yeah. Like an ideal healthcare clinic would be
where money isn't like as much of the focus, right?
Yeah, it would be seeing someone, 1 an hour. And I, don't get me wrong, there are places that are like that. I know of hospitals that do it, outpatient hospitals. So there are places, but they're far and few between that run like that. But yeah, if every clinic could operate that way, I think therapists would be much more happier. I think patients would be much more happier. And possibly you'd get better outcomes faster.
Which I think is ironic, because what's hard is I feel like they're like, oh, we'll just jam all these people in and we're saving money, right? They're like, or, as a clinic, you're like, I have to jam this many people in. And as an insurance company, they're like, yeah, we're paying so little. But then it feels like if you were actually giving the quality of care, you would actually have better outcomes. So you wouldn't have to maybe spend as many visits or spend as much time.
Right.
But it just feels like it's like a cycle that has turned upon itself. So because there's that monetary focus, then you're not able to spend the time. So then people actually, so it's almost like that focus has actually made it worse, or it created the problem it's actually trying to fix.
Right. Yep. that just prolongs their amount of therapy they need, because you're not there to really give them what they need or give them the correct exercises. If it's a busy day, they're gonna keep doing the same thing, and you're not going to change anything because you just don't have the time to go in and fix what needs to, or adjust or progress, or do that with them.
And then unfortunately there's also the percentage of patients that fall through the cracks, that get discouraged by a busy schedule like that, and then just go off, and then their problem's never addressed, or they end up with something far worse and they actually have to attend. But for your world, like, what are some of the like advice or things that you would offer for as like the baby boomer population? I know I've seen you do stuff on like the importance of monitoring vitals, or educations on balance, or this and that. Like, what is your advice for people as they are aging, or just things like that you see in the home that you wish you could help prevent?
I think obviously the big thing is, fall prevention in a home. There's so many risk factors, but also just I see there's so many patients that are sedentary, or they know like, oh, I know I should be exercising, or I know I should be eating better and doing that, and they don't reach out for help, and they don't have, the doctors don't encourage it, and so I feel like they get pigeonholed until something actually bad happens, and then by the time we get there to see them, they have all this weakness, all this declining mobility, because no one really spent the time or took preventative action, whether it was through the primary care or some other healthcare practitioner. I was like, you're not walking as good as you were before, or now you have a cane. Why is that? We should try to get you some help. And I would just, and it's hard because if you don't know that you need it, and patients don't advocate for themselves, right? They don't do it very well. And so that would be my biggest thing, is just, if you feel like you're not moving well, or just something, you're coming off, especially having COVID, or they get UTIs a lot, like all of that prevents or causes weakness when you're not moving every day. And just trying to get in to see your doctor and advocate that, hey, what about physical therapy? Can I go and do that? And I think that's the biggest thing that I would tell these older adults is, advocate for physical therapy. A lot of them were like, well, the doctor didn't say I needed it, so I'm not going to do it, or I didn't think I needed it until it's too late. So that's a sad part. And I'm biased because I'm a PT, but I think almost every older adult should routinely or annually get screened by a therapist to figure out, like, oh, from this year to last year, your mobility decreased or your strength decreased. We have the standardized tools and tests to measure all of that, and to say that, oh yeah, now your balance has decreased, or getting up and down from a chair is a lot harder for you, and we need to work. Why is that? And maybe it's working on leg strength, and balance isn't great, let's improve that balance. So we have the skills. I almost feel like we should be primary cares where you come in every year, and you get your fitness assessment bias done, and we decide, like, yes, you would benefit from physical therapy, or no, you would benefit from just an exercise program. But we don't control that. Physicians do. And there are a lot of physicians who don't think that PT is necessary. So,
and it's interesting because I always tell people, like, I'm probably biased too, right? Because I'm like, physical therapy, we're not curing cancer. But to be honest, there are a lot of things that we could do that could prevent these unhealthy. It's interesting because I read a thing about primary care physicians that they get a lot of most of their education is not focused on prevention. So, and it's interesting that they never even think to send someone to therapy. And then you battle sometimes from an outpatient perspective that, like, you have a surgeon who's like, but I did such an amazing job, you should just go out and walk. And then this poor person walks terribly because they've had this surgery and then they don't know and they've had pain. And then I'm going to see them eventually, right? I'm going to
Yep.
see them because they have now back pain and hip pain and all this other stuff because the surgeon just said, go walk. I didn't even think that therapy would be necessary. And I feel like, again, we're missing a huge component where therapy could be preventative or just, and I think also just people don't even know how much of a benefit it could be. So I appreciate you bringing that up because it does make me sad that people are just at home and doing their thing. And not everybody loves to exercise, but there is just an important component of it. And that is sometimes where you just start seeing where the people are like, can't get off the sofa, and they can't walk across the floor without shuffling, and then there's this fall cycle, right? And then there's this whole thing with that. And this is probably out of our wheelhouse, but it is interesting that you mentioned the UTIs because I also see that as a higher percentage in the older adult population, and I'm not sure if you have a supposition as to why, but I also noticed that I just have to spend a lot of time educating my adults on that, or at least getting them to go seek care, or
well, another huge thing is that it's hard to get them to drink water. So sometimes hydration and diet too isn't great. So I think there's a whole lifestyle piece, and that's a whole education piece that I do with every patient. But you don't get that time in the outpatient clinic to do that, to spend a good 20 minutes educating on water intake, protein intake, what you should be eating, what you should not be eating. And so that's part of what I love about spending time. It's that there's so much lifestyle piece that goes into the plan of care too.
Well, it's also interesting. I get a lot of them where they say they don't want to drink water because they don't want to go to the bathroom. So they don't want to get up. They don't want to have to go to the bathroom. So they've stopped drinking their water. But I also appreciate that you're everyone. Well, first of all, if someone even knows what a physical therapist is, and then a lot of times they just think we just stand there and tell people to exercise. But there is such a big education and almost preventative component to our basically our field that sometimes I think it gets underutilized in that. Because then they're like, oh, I go to physical therapy and I just exercise for an hour and then I go, maybe a therapist rubs on me or I get electrocuted and I go home. Whereas if it's utilized correctly, that education component is so important. And I appreciate 100%. That you brought that up. So I'm actually really glad that you're spending that time.
Yeah, and it's necessary. I mean, they're just, you can't exercise and expect to get stronger without having a good diet and staying hydrated and all of those components that go into it too. So
yeah, and I think that is part of it. People step into therapy, do their things, go home, and then you have no idea. You're hoping that things go well till the next time. But again, you probably in the home get to actually see a little bit more of a smidge of like what's actually happening.
Yep, 100%.
So I feel like I've interrupted you a gazillion times, getting so excited about all the things you're saying. But if there was one other piece of advice or just anything for the healthcare system or just even just for your seniors or, obviously we've gotten the message send everybody to therapy, especially the kind where they can actually have the time in the therapy would be a component, which is nice. Again, you do accept referrals and Medicare referrals and things like that. So that they could actually have this time and it doesn't count as a home health. They don't have to be homebound. So that's nice that you're able to operate under that component. But what would be a last piece of advice or just even a commentary on the system or just what's out there?
If there's so many different pieces with our system, the reimbursement rates keep going down every year, but people still want the quality of care given to them. And it's, I don't know, it's hard as a business owner too. It's hard, I think we struggle through being a therapist and then if you own your own business, being a business owner. Because if you're a business owner, you're in it to also make a profit. But as a PT, you're in it to help patients and do whatever it takes that's necessary to help them. But there's always that piece of like, okay, well, you're a business, you have to turn a profit too. And so that's the hard part with healthcare, and something as being a business owner definitely opened my eyes up to that, when you're under the umbrella of a big company, corporate company, you're not worrying about the little nuances of running a business. But yeah, I think just healthcare in general, unfortunately, it's overwhelming right now. And I feel like the system is taxed because there's so many older adults in it. And so many older adults that are sick and unhealthy. And so they're constantly utilizing the system. And if we could be more on the preventative side and help them before they get sick, help them before they fall, that would help. I don't know that it would lessen the burden a ton, but it, certainly should. But it's hard. It's hard to get that preventative message out there to them without the help of all healthcare professionals, not just PTs and OTs, but the primary cares need to be behind us, the surgeons, when they get discharged from the hospital. I've run into numerous families and patients who get discharged and no therapy was set up, and they were in bed for a whole week and they just go home with nothing. And so it's hard. Yeah, I would, if we could be more on the preventative side and stop a lot of these chronic diseases, obesity, diabetes, heart, high blood pressure, all of that can be preventative, right? All of it has a huge lifestyle component to it. But they go to the doctor and then they get a pill thrown at them, and it's never like, okay, well, how about you try to do physical therapy or try to do some kind of exercise program that can help you with this. And so that would be my one piece of advice, is just trying to be more preventative and proactive in your healthcare, in your fitness level. You're going to have people who just don't care and they want the pill and they want the easy fix, obviously, but there's a good group that would want to do the work and would want to change that. They're just not educated and they don't have the someone leading them to tell them this is what you can do versus here's the pill. Right. So yeah, that would be probably the best advice and piece that I would want to leave, is if we can help the healthcare system in any way, it would be trying to do that.
It's interesting because I feel like for years we always talked about the baby boomer population getting older. And I feel like nothing really was done to prepare for that. Like, we're like, oh, they're going to really tax the system as they get older. And we're like, okay, well, that's coming, right? And it's like watching it and you're just standing on the sidelines, and now we're like, ah! And it's, I also ran a quote under a Medicare thing that had said they didn't consider prevention medically necessary, which is sad for me because, again, it's almost like wanting to breed a source of like illness, wanting to breed these things where you have to spend this stuff. So I feel like the message is also like you need to get that to the patients, that they need to fight for their own health care, which is sad, but they need to try to fight for that prevention. We need to get these practitioners focusing on that and getting away from whatever pharmacy company came in that day and gave them the newest pill for diabetes that we don't really know what it's doing to our people, right? So I appreciate that, because I feel like a lot of times if you can catch it on that end, you actually end up saving a lot of money for not only the patient, but the insurance companies, maybe not the pharmacy companies, which, we all know where that, but like that rabbit hole. But again, as a PT, so much of our job is focusing on function and wanting people to actually have good lives.
Yeah, absolutely.
So I really appreciate you just spending this time with me, and I'm happy that you kind of started carving your niche and trying to have an area where you do actually make a difference in people's lives. So there is always a potential happy ending. Again, fully understanding the nuances of balancing a business and that. So again, it's not all roses and all the things, right? But so again, thank you again for spending this time with me, and we're going to let Lianne get back to actually have family time. So,
no, absolutely. This was fun, and thank you for having me.
Thank you, and we'll sign off from there.
Thank you again for tuning in to the SOH, or State of Healthcare. This is Tracy Karras from Better Fit Therapy, asking you to tune in each week as a new podcaster. If you can like, subscribe, share with your friends, find us on social media, but also feel free to comment. Let us know some areas you'd like to explore. What are some concerns you have with healthcare? Let us find some areas that would help relate to you, what's going on with everybody else, and help me raise some awareness so that we can work on some change. Thank you again, and have a good night.